Thanks, Eugene. So as we start to as we get started, in the same vein as in sharing my quote with you, as I was doing this, I was thinking about when I was in the classroom. So I was in the classroom for about 20 years or so. Which, as I'm saying this now, I'm remembering that I need to introduce myself to you all, and I apologize because I've done this a lot this week. But my name is Amy Smith-Zioli. I am a special education support specialist here at EEC, and I'm lucky enough to be able to head up our behavioral health team here at EEC. And we are doing what we can behind the scenes in terms of creating meaningful supports for teachers and caregivers who are trying to manage the best they can mental and behavioral health needs within their classrooms, within their family child cares, within their before and after care. And so I have worn many different EEC hats over the years. I was in the classroom for about 20 years or so I did director, lead teacher, assistant, sort of worked my way up. Before that, I was a family child care provider out here in Western Mass. And just before coming here to EEC, I worked for our public school system out here in Western Mass, Deerfield, Whately, Sunderland, Conway area, and was the director of early childhood education. So I've been really lucky to be able to work in all these different realms and feel like I have been really lucky to have worked with some just incredibly dedicated and skillful educators over the years. But one of the things I was thinking about this morning was my time in the classroom, and we used to have newsletters, and we always had we had a quote corner, because one of the things that I felt was just fantastic about working with kids on a day-to-day basis with, of course, some of the things that came out of their mouth, right? And their quotes and their comments. And so I would ask you all if you can think of a quote or a comment from a child in your care that was that just put a smile on your face. If you could add that to the chat, I'll share mine with you that popped into my head this morning. So I had it was a preschool classroom, and I had a child who I was very close with, and was just very sweet, kind of put her hands on her hips and look at me like we were girlfriends. And she said, "Miss Amy, you look a little bit pretty today." And so that has stayed with me for a very long time. And I think of that often, and it just makes me smile. And I'm sure that you guys have a lot of those types of moments with your own children that have been under your care. And so if you can think of some this morning, just pop them in the chat and just kind of lift us up a little bit today. As you're all doing that, I'll talk about the rest of the agenda. So we're going to talk about behavioral and mental health in the early education field. We're going to talk to our behavioral health team today, and they're going to talk to you all about some of the supports that they provide and sort of what they lean on for strategies when they're showing up to classrooms to provide support. We're going to talk about our street initiative and our wonderful partnership with the Office for Child Advocate. I'm going to talk to you a little bit about our hopes and dreams and aspirations as we move this work forward, and then share with you some ways to gain some new resources and some additional information.
Yeah, and Amy, while we're having people put things in the chat, just a reminder to speak a little slower than typically, since we have a large audience today in 3 different languages, and it helps folks keep track. Yeah, so
thanks for that, Eugenia. And I can see you, so you can be like, you can make hand gestures to me.
Yeah, we'll have like a slow down hand gesture.
Yeah, happy to have you do that. Thank you for that reminder, Eugenia. And also, as we are moving forward with the information, if you have questions, there's lots of us here today, but if you have questions, feel free to go ahead and put those in the chat. And if for some reason we run out of time, myself, our behavioral health team, the OCA will make sure we get back to you with those answers. So As we get started, I just wanted to kind of ground us in the importance of mental behavioral health and social emotional learning, and the essential part that that has on child development, right? I know that I'm in a room here full of early childhood educators, and you all know the huge impact that this has on our young kiddos. But it always serves us, I think, as a reminder that it really has to be the foundation of everything else we do with kids. Without that solid foundation, kids cannot access the rest of the curriculum that's happening within a classroom, within a family childcare, within an after school program or before school program. We know the long-term benefits are encompassed, the long-term benefits really fall under the umbrella of being able to um, have a rich understanding of being self-aware, having self-regulation skills that keep them from becoming dysregulated in a classroom. It enhances their social skills. They're able to then perform and have engagement and curiosity and wonder within a classroom. And they're able to foster those rich, positive, long-term relationships that we know are so important in early childhood. Kids learn in the context of relationships. And so this is why we spend so much time talking about social, emotional, and behavioral health, and really trying to help educators create very intentional um, learning moments within their classroom where they can talk more about social emotional learning and build those positive relationships with their students. So here's some of the current challenges, right, that we are facing within the field of early education, and this will come to no surprise to anybody who probably is joining us for today. But these are some of the things that we are really see sort of rise to the top. And we get a lot of this information from our early childhood mental health consultation data that we receive. We see this as our behavioral health team is going in and out of programs and really helping programs to manage some of the behaviors that challenge. Um, we see that aggression is something that we are seeing in our very young children. And when I say aggression, we're not just talking about kids that we might think are not listening or not following direction. And we're talking about big behaviors, really big behaviors that often leave teachers and directors with real safety concerns about what is happening within a childcare setting. um, those social skills that we just talked about a little bit. We're noticing that kids are not where they would typically be at certain ages, right? So what we know to be age developmentally appropriate social skills, we are really noticing that kids are struggling with being able to engage with their peers, to be able to engage with their early educators. Um, in a way that feels meaningful and effective for kids, where they are then encouraged to then be have a lot of serve and return interactions with the folks that are around them for the day. Um, we are seeing anxiety in our young children, not just our older children, but much younger. And of course, a lot of times the way that this manifests, the way that it manifests in all people and older kids even, but especially in young children, is that physical piece, right? We can see them, their stomach hurts, their head hurts, lots of different areas where anxiety is sort of creeping in, and keeping them from being able to engage in a way that we would want them to be able to engage. Um, and of course, we see a lot of times those trauma responses. We know, again, as early educators, that behavior has meaning, right? And we often have to be detectives to figure out what that meaning is. And so often, when we really put that work in and figure out what that what that behavior is telling us, it's often more heartbreaking, right, than it is sort of more frustrating to us when we actually find out the meaning behind that behavior. And so that has sort of led us also to wanting to explore how are we giving educators what they need to be able to support kids within their classroom who are showing us these behaviors because of traumas that have happened. And in the center of this all is, of course, our workforce that is trying to juggle and manage all of these behaviors that we're seeing in the classroom, as well as um, perhaps their own response that could be because of secondary trauma or because of their own stress. And there is, no doubt that to be able to manage all of this within the context of a classroom is really, really difficult work. So we really have to ask ourselves as a field, what are we doing in terms of our teacher wellness? How are we supporting them so that they can turn around and support kids? Right. And our big line is now a dysregulated teacher cannot help a dysregulated student. It cannot help a dysregulated child who's within a program who really needs somebody there as a more of a consistent basis. So we know that that's something that we have to look at. Um, and so when we think about the goals of mental health and behavioral health supports that we have here at EEC, as I've been saying, we want to be able to help teachers build a foundation of effective supports that can really help to foster social emotional learning and development, something that will prevent those behaviors that challenge, and something that can prevent kids from becoming so dysregulated that it's really difficult to come back from that, right? And to when there's safety concerns. We want to be able to reduce the use of exclusionary discipline across our entire education mixed delivery system. Um, and we want to be able to identify ways to support educator wellness. And I only left trauma informed and responsive for last because we're going to talk about that more. We're going to highlight that street initiative. And I'm not going to tell you what street stands for. I want you to sort of guess because we've decided, we really love our acronyms. And so we are in the middle right now of launching this initiative that we call Street Week. And so this is kind of our Spirit Week for our trauma informed and responsive trainings that OCA is going to talk to you about a little bit later. So we're very excited about that. And I'm going to turn it over to our behavioral health team now to introduce themselves and talk a little bit about ways that they support programs, the technical assistance that they're able to provide. We're a very new team. We've only been established for about a year and a half or so. And so I'm going to pass that along to them to do the next few slides. And you guys just give me a shout out when you would like me to change the slide.
Sure. Thank you, Amy. And I'm just going to preface this to say that I also speak very fast. I know that I do that. So if I need a reminder, please just let me know. My name is Stacey Ware. I am a behavioral health support specialist. I am out of the Southeast region. I also am supporting the Northeast region. I am the newest on the team, so I've been here since late September. But I have extensive experience working in group care, group homes, shelters with families experiencing homelessness. But most recently, I spent 10 years working in a public school district where I managed the out of school time programs. And so I come from the provider world. I'm excited to be here and supporting providers. Before we go on to the next slide, Chris and Alexis, do you want to unmute and introduce yourselves now, or do you want to wait till your slide?
Sure, we can go next. So hi everybody, I'm super excited to be here. My name is Chris Lloyd. I am behavioral health support specialist. I support Region 6, which is the Boston metro region, as well as along with Stacey, Region 3, which is Northeast Massachusetts. I come to this work from 7 years of experience in the early intervention world. and doing parent and educator coaching through that. And prior to that, I was a preschool teacher. So I've been in multiple shoes. And I'll pass it to Alexis to introduce herself.
Good afternoon. My name is Alexis Thibodeau. I'm also a behavioral health support specialist. I support the Western and Central region. I come to this role almost a year now. I have extensive experience working with children and families. I've taught in preschool as well as became a director working my way up. And then I also worked for early intervention for several years. And then my previous role prior to coming to EEC was working with in-home therapy and helping support children and families with keeping them stabilized in their homes. Nice to meet all of you.
Thanks. Okay, so I will review the mental and behavioral health resources and supports that we have for our program. So as you can see, it's, there's kind of a graphic and it's listed out. So you've met us, the EEC behavioral health team. We're the people that sit in the regional offices, and then we can go out and meet with programs. Referrals come to us in various ways. They come to us through programs themselves, through our licensing staff, through our early childhood mental health grantees. So we can get referrals from multiple ways. I had the privilege yesterday of going to an out of school time program and spending the afternoon there, and it was loud and it was chaotic, and I loved every moment of it. And so those are the things that you'll see this team doing. We can go right into the programs, meeting with staff, meeting families, meeting children, and providing sort of the following supports. So EEC has the Early Childhood Mental Health Grant. That is a grant that provides regions. We have external partners, and that you'll see those partners coming up, that can provide coaching and professional development support. So after we've come into a program, we may say that you need longer term, or you would like to have longer term support. We really are the bridge that bridges that gap between a program and these grantees. So then they are able to come in and, like I said, provide coaching support to staff and directors. They're not going to work directly with children. They're not there to diagnose. They're not there to assess children. They're going to go in and provide resources, provide tips on classroom management, provide professional development. Number 3 is the pyramid model supports. You'll hear Chris talk about those more in a little bit. So we use a pyramid model plus training. There's communities of practice. There's other supports that we use through pyramid model. So I'll leave that for Chris. We also have the statewide Professional Development Academy. Those are our professional development centers. Again, those are statewide. You may hear one of us say, do you want us to connect you with the professional development centers, the PDCs? As Amy said, we like acronyms. Those are, again, going to be coaching support, training, and they may be more support in terms of program management, quality management, things like that. Then we have our Commonwealth Preschool Partnership Initiative. This is a grant and it's a support to communities around inclusion, special education, and pyramid model. It's a grant where some of our public schools will have an itinerant team that will go out to a private preschool and provide support to those preschools. Yeah, thanks, Amy. And so this is some of the stuff that our team does, the behavioral health team. We provide resources and technical support. We provide that around social emotional development, positive behavior initiative strategies, so PBIS strategies, de-escalation techniques. And then also a lot of the work that we're doing is around exclusionary discipline and the development of exclusionary discipline policies and consultation around that. We're here to collaborate and coordinate resources. So we may be able to collaborate with EEC staff, your licensors, your regional teams, the quality teams, and the priority population providers. We'll continue to develop protocols and frameworks, guidelines to support implementation of support services. And then last, we'll also provide referrals to our grantees. As I mentioned, we go into a program, we may see that there are longer term supports that you would like to access, and we'll provide a referral, a handoff to them. Thanks.
Sorry, Stacey, I didn't mean to do that.
That's okay. And then we'll also coordinate with our professional development centers. So our behavioral teams meet pretty frequently with the early childhood mental health grantees, the PDCs. We meet with the regional offices. We meet with the quality specialists. So we're constantly in communication. Our hope is that programs feel a shift in EEC and how we can support. This is really, we can't support our children if we're not supporting programs. And so that is our hope. We hope that you feel comfortable reaching out to us. This is really just to provide support to you so that you can better support the children in your program. I think I can go to the next one, Amy, and then I'll pass it to Chris.
Hi, everyone. I have the pleasure of really diving into our guiding principles and really what the state is using, what we use when we go into programs, and thinking about supports and thinking about what makes the most sense. The pyramid model, which I'm going to give a little bit of a higher level overview of what the pyramid model is, and I'm going to give you some resources. They're going to be in the chat. Thank you, Alexis, for sharing those around what the pyramid model is and what supports there are available in training and professional development communities and things like that around pyramid model supports. So the pyramid model is really the gold standard that the state uses, that we use to really think about the level of supports in the classrooms and in programs to address behaviors that challenge. It is not a curriculum, it's a framework that really helps us to think about what supports are needed both at a classroom level, at a program level, and as well as at an individual child level. And so if you think about a pyramid, Amy, if you can go to the next slide. If you think about a pyramid, really the lower level supports in the pyramid are really those supports that are universal, right? That they work for all children in the classroom. They are, an example of the sort of lower level tier one support might be, providing materials in multiple languages. It might be providing like visual timers, using multiple modalities in the classroom to communicate materials and communicate ideas, those kinds of supports that support all children. And then the further up in the pyramid you go, you get in sort of some of the more targeted social emotional supports. So this might be targeted social skills groups, things like that, that work for some children that really need some additional supports around social emotional learning and behaviors that challenge. And then when you get to the top of the pyramid, that's where you really focus in on those children that might need some more targeted one-on-one supports. And so those may be those kiddos that really have some of that, the strong aggression that Amy had talked about at the beginning, had behaviors that aren't really being helped by some of the lower level supports provided in the classroom. And undergirding all of this is an effective workforce, right? Can't do any of this work without effective workforce in the classroom, without teachers who are committed to the work, and without teachers who feel supported in the work. And so that's really what we're thinking about when we go into programs as a behavioral health team. We're really thinking about the supports that we provide in terms of pyramid model supports. Alexis is putting a number of things on the chat, including the fact that there are a number of pyramid model trainings available through your Strong Start, through the LMS, which I would highly recommend using. There's great handouts there that are available. There's great resources on the LMS through Strong Start to everyone that would really provide some really great training in pyramid model. Pyramid model also has its own website, which has some amazing resources and amazing handouts that are all free. That's challengingbehavior.org. And in addition to that, more recently, every region in Massachusetts is open to Pyramid Model Plus supports around Pyramid Model learning communities. And so there's a handout being shared, and we'll email this to you afterwards as well, around really learning communities around Pyramid Model, really talking with other programs that are utilizing Pyramid Model supports, really giving you an opportunity to connect across the state and across your regions with programs in utilizing Pyramid Model supports in classrooms and in programs. So Pyramid Model Plus is, again, just offering professional developments for these services. And it's led by Connected Beginnings, which is a program of UMass Amherst Donahue Institute. And any questions related to that or related to the trainings and the Pyramid Model Plus communities can be directed to Catherine Wakely at the email address provided. And again, we'll be emailing you all of this information as well. So stay tuned for more information about that. But Pyramid Model Plus is really providing a lot of supports and trainings across the state in Pyramid Model implementation. Go to the next slide, Amy. So when we're thinking about Pyramid Model Plus on the ground, or Pyramid Model supports on the ground, what does that look like? And we here at EEC really like to think about what we lovingly refer to as the Big Five. And that is a 5-to-1 ratio of positive versus corrective interactions, predictable classroom schedules, routines within routines, intentionally teaching behavioral expectations and self-regulation skills, and intentionally teaching social skills. And so these 5 core principles are really a lot of what undergirds our work and is really sort of tied back into the Pyramid Model supports that I mentioned earlier. And there is, we can, if you're interested, we can send you more information on like specific strategies and things related to the Big Five. But again, it goes right back to the Pyramid Model supports and thinking about those tiered supports in classrooms and in programs. Okay, and I am going to pass it off to Alexis to finish us off with talking about the mental health consultation grants and what those look like.
Thank you, Chris. So we talked a little bit about our early childhood mental health consultation grant supports, but I wanted to tell you a little bit more of when you contact them, the different things that they can support educators and children in the program with. So one of the things that they can do is they can do a classroom observation. And with that observation, they're able to help work with strategies to be able to create by creating supportive learning environments. They can also train and coach the educators, as well as guide them in developing any ongoing partnerships with families, or just having those challenging conversations, helping you being able to support having that conversation with the families if there's a concern for their child. They can also do an individual observation and assessment of children. However, that observation would be with parental consent. So that would be having the conversation with the family, letting them know that we have the support of the grantees, but you would need to obtain parental consent for that observation. One thing that I would like to highlight is, as a team, we've been able to go out and help support programs to be able to maybe start doing that individual observation, not necessarily an assessment, but be able to have separate set of eyes in the classroom, and then maybe working with the director or the educators to be able to facilitate that conversation with the family to maybe initiate that individual observation. They also are able to help with any individualized behavioral support plans for children. And how they do that is not only do they take the input from the educators, but also the parents too, because they know their children best. So being able to help prevent those concerning behaviors, and also maybe being able to give some supports, not only within the program, but also at home, so that that child's having the consistency of those supports. And then the other thing that they can do is they can also help make referrals to any community-based services. So whether that be CBHI services, or maybe it's getting an evaluation, being connected to the public schools, they can also be able to help do that as long as they have parental consent. You can go to the next slide, Amy. Thank you. And then we have the mental health grantee, the consultation, but each area has their own supports. So when we're looking at Western Mass, it would be Behavioral Health Network as well as the Collaborative. Empower, I feel like they support most of our regions. They have those kind of catchment areas that the other providers aren't supporting. So that would be Canton, Westboro, Quincy, Foxborough area. And then we have Community Health Link, which is Together for Kids, and they do Central Mass. And we also have the MSPCC, which is the Massachusetts Society for Prevention of Cruelty to Children, and that would be for the Northeast region. We have the JRI, which is the Southeast region, and then we also have Walker, which is the Boston region. And I know this is a lot of information. We're talking about all different regions, but we'll also follow this up in the email so that you know which one would support you in your region. And also as a behavioral health team, we can also support you to help you get connected to them as well. Thank you. And then
Fantastic.
we have the new initiatives for 2025. So we've been working really hard to be able to help support educators in your programs. So one of the things that we've been working on is we've been soliciting to a vendor in order to develop a toolkit so that it can support programs. Ways that it could support programs would be to help establish some behavioral health supports for the children and educators to be able to enhance that social emotional learning. We also are looking, as Stacy had mentioned earlier, to help develop program policies to help reduce that use of exclusionary discipline. And that's another thing that our team is really doing. We want to be able to support you. So if you need that support, that's what we're here for. We're also working on a supplemental resource guide to give you technical assistance and to help you build a reflective practice, as well as sustain best practices in social emotional learning. And then we're also providing additional trainings for educators, leaders, and support partners. And then I know Amy is going to talk a little bit more about this, but one of the big things is trauma-informed and responsive training opportunities. So on our LMS, we've been able to have some trauma trainings that I believe they came out last Friday, which is a series of 6. And we've been able to do this with our partnership with the Office of Child Advocate and the Center on Child Wellbeing and Trauma. And then I know Amy told you to think about what STREET stands for, because this week we've rolled out our STREET initiative, and it's Strategic Trauma Responsive Early Education Training. And that is on the LMS to implement those training series for educators and leaders.
Fantastic. Thank you so much, Alexis. And in that same vein, as we are talking about our street initiative, I am actually going to turn it over to our OCA colleagues to go ahead and introduce themselves as we look at your beautiful faces on the screen as well.
Great. Thank you, Amy. I am actually the sole representative of the OCA today, so thank you for having me. My name is Joy Cohen, and I am a deputy director over at the Center on Child Wellbeing and Trauma, which is a division of the OCA. On your screen, though, you see Maria Mosides, who is the child advocate, our incredible leader. And right next to her, you see Audrey Smolkin, who's another incredible leader, and she is our executive director at the Center on Child Wellbeing and Trauma. And then to my side over is Alix Riviere, who is our senior policy and research analyst, who actually developed the content or led the work to develop the content that went into the LMS trainings. So we work collectively and collaboratively to develop and implement in collaboration with Amy a lot of the street initiatives. So I'm happy to be here today to talk to you about those. But first, I want to tell you a little bit about the Office of the Child Advocate and sort of what we do. So the Office of the Child Advocate, or the OCA, is an independent state agency that provides oversight of state services for children with a particular focus on children who are in the care and custody of the Commonwealth. And there are 3 divisions of the OCA. One is our policy and implementation team, and they work primarily to research and make recommendations around policies and practices and regulations and laws that improve the lives of children and youth across the Commonwealth. We also have our quality assurance team that does a lot of things. One of the things that they do, though, is man our complaint line, which is a place where anyone who has a concern regarding a child or youth who is receiving state services can call, and we can provide that caller with resources and information to support resolution. And then we also do examine systemic issues related to the provision of services and coordination of services so that we can ensure that each child and youth has the opportunity to live a full and productive life. The 3rd division at the Office of the Child Advocate is the Center on Child Wellbeing and Trauma. And the Center on Child Wellbeing and Trauma was established in 2021 upon recommendation by the Childhood Trauma Task Force. And we support child-serving state agencies in their work to become trauma-informed and responsive. And we do that through trainings and technical assistance and through resources and information sharing. Some examples of some recent statewide initiatives, some partnerships that that are underway include our Trauma and Racial Equity Empowerment Series, TREE, it's called. It's a TREE Academy. And that is there are 13 child-serving state agencies that are participating in that series. And that is really focused around our collective responsibility to promote equity and racial and traumatic empowerment. And it's been a tremendous series. We're actually approaching the tail end of that work and planning for our 2nd cohort. So that's very exciting. We also are working with DTA, DPH, and DCF on some initiatives. And you may be familiar, you may have attended even some of our trainings around newcomer children and families, and that is implemented in partnership with EOHLC, which is the Housing and Livable Communities Department, EOHHS, and EEC. So lots of exciting initiatives happening, but today I want to talk about specifically the initiatives that are happening around street. And before I do that, I want to sort of ground everybody or invite everybody. And I see a lot of familiar faces on the screen. So I know that some of you joined us this week for our Core Champions training, and you know very well what these are. These are our guiding principles, which are our drivers for pretty much everything we do at the Center on Child Wellbeing and Trauma, and also how we promote trauma-informed and responsive practices for child-serving agencies. Our street initiative is our partnership with EEC, and it includes multiple pieces that sort of, when put all together, reflect an approach towards systems change, which is extremely exciting because it recognizes that it really takes all members of the system to work together to respond to children's trauma. And as Alexis mentioned, one piece of that is the LMS trainings in Strong Start, which is, as Alexis pointed out, a series of 6 individual modules that are framed around our guiding principles and that get into sort of foundational information around what trauma is and the effects of trauma, but also starts to work to engage educators around strategies to promote healthy relationships and empowerment, voice and choice, and transparency and trust, and equity, anti-bias, and cultural affirmation, and safety, which are all our guiding principles. So we're really excited. And the idea would be that early childhood educators and program staff who are working with children are able to take the LMS, which is accessible to everyone working in a program, and be able to bring that foundational learning then into a second piece, which is our deeper dives. I'm kind of skipping around, Amy, different parts,
Sorry,
so
Joy.
I apologize. No, you're fine, you're fine. Which is our deeper dives. So the deeper dives curriculum is literally what it says. It's a deeper dive into trauma and resilience, and a much deeper dive into some real concrete practical applications and strategies that educators and program staff can implement in their programs and in their work with children. So again, the idea would be that educators and program staff would take the trainings in the LMS and then be interested in deepening their understanding and their practices and take the deeper dives. We want those deeper dives to be accessible to folks in all regions. And so we are also working on an initiative, which is a train the trainer, that will focus on preparing a large group of professionals to actually deliver the deeper dives. And these professionals are referred to as the core champions, and they really are the champions that will offer some sustainability around the practices and really carry and partner with educators to implement those strategies that we taught them in the deeper dives. A fourth and crucial piece of the street initiatives is our work to train EEC field operations staff. So that includes licensors, it includes investigators, all regulatory staff really, and program quality specialists. And those are customized trainings. They were 2 full in-person day trainings, and then include, which we're about to launch, 3 communities of practice, which are 1.5-hour sessions to follow and to focus on expanding those things that they learned and really bringing that theory into practice, and supporting them that way. So those trainings have been done. Our first core champions train the trainer day is done, and response and participation has been wonderful. And it's really refreshing and inspiring to see so many professionals get around embracing trauma-informed and responsive practices on behalf of children across the Commonwealth. So we at the OCA are extremely excited about our partnership with EEC, and certainly welcome any questions into the chat. And Amy is a great contact too for any questions around the street initiatives. So thank you so much, Amy. Is there anything that I left out that you wanted me to touch on?
No, you were fantastic, Joy. I couldn't keep up, but you,
Okay. Okay.
no, you did it. Absolutely fabulous. What I will do though, is I just want to hover on this slide for a moment so folks can see this is our flyer for the LMS training. And this can be put in the chat as well, but all of our LMS trainings are available in English, Portuguese, Spanish, and simplified Chinese. And so you can use these links. Again, as we mentioned, these slides will all be shared with you, or the QR code to be able to get to those LMS trainings. And our hope is that you sort of dig into those, and then, as Joy said, maybe join us again in the spring, late spring, when you see that there's additional offerings from those core champions, to be able to dig in a little deeper, and to expand that training on trauma-informed or responsive care. So, and I'm just going to go ahead and flip forward a little bit because Joy was so efficient at talking about those. Thank you so much, Joy. Much
Thank you.
appreciated.
Thanks, everybody.
And this is just an overview of some of these street opportunities that we talked about again for this week. Joy has sort of gone over those, but we're here now right in the middle of street kickoff week. We have another session tomorrow, just like this Lunch and Learn, because we really wanted to give folks the opportunity to sort of tune in and share what we're up to. We know it's hard to stay a lot of times up to date on what's happening when you are in a busy classroom, when you are certainly doing a family childcare, before and after school care, it's really hard sometimes to be able to keep up on what's happening. So we hope that while might be a repeat for some folks, the word is out that these not only are these trainings available, but our behavioral health team is here to be able to support as well. And I just wanted to spend a few minutes talking a little bit about moving the work forward as well. So it has been such a great year building our behavioral health team, creating this wonderful relationship with the Office for Child Advocacy, and creating these training opportunities. But one of the things we said when we started to create the street initiative was that we didn't want it to be a one and done. We wanted it to be something that continues to grow. And so that is why there's the creation of the communities of practice. And we're very much interested in getting feedback from you all on what else would be helpful. And so as we start to sort of take that mindset on, this shouldn't just be a one and done training, we're looking forward as well, like where we know that the field in general is one that is we're really in the crux now of a bit of a crisis when we think about where kids are at with mental health and behavioral health, and where our teachers are at in the workforce burnout. And so we really want to try and be as responsive as we can to that. And so this is really just scratching the surface of where we hope this work will go. A few areas that we obviously want to be able to increase our capacity, right? Just from we are a small but mighty team, but we do cover, as you can see, regions and a half. And we know that the need is great. And so we're really hoping to be able to increase capacity, expand our team, expand our efforts, as well as expand the efforts of our mental health grantees as well. Because we know oftentimes there can be a waiting list to be able to receive services from them. So while we hope to sort of be able to fill that gap, we know that we want to be able to expand those services. Crisis management has come up many times, as we indicated, the behaviors that we're seeing, those sort of big aggressive behaviors and big feelings. We know that many times classrooms are finding themselves in the middle of a crisis situation where safety is a true concern. A child is eloping out of the room. They're becoming very violent, and there's a big concern about not only the safety of additional staff, the staff that's in there, but also peers. And so how are we supporting programs in that particular area, and how can we increase our ability to be able to support? And we know that there are mobile crisis teams who do fabulous jobs, but we also want to ensure that the crisis management that shows up to support is also very well versed in early childhood education. Showing up to a 3-year-old in crisis is very different than showing up to a 13-year-old in crisis, right? And so we want to make sure that kids and teachers are getting the care that they need at the moment when they need it the most. And so that's on our minds as well. As we said over and over again, being able to support early childhood educators in their own wellness. We'd love to be able to create opportunities for the workforce to participate in reflective practice, to really be able to have sacred time and protected space to be able to think about the work that they're doing and share some of the things that are happening within the classroom, their frustrations, their worries, their own mental health around perhaps something that they saw within the classroom that felt triggering. We want to be able to have those spaces for teachers so that they can feel like they have the time that they need to work through some of this really challenging issues that are popping up within our field. And because we had such a wonderful experience with the OCA, we do have our other partnerships, of course, with Department of Mental Health, Department of Public Health. And so always looking at ways that we can create initiatives such as the Street Initiative so that we can expand a lot of our resources and be able to support the best that we can. And, you know, again, your feedback and hearing about what works within your programs is always really, really, really helpful to us and inspiring. Wanted to share our two websites. So most folks are familiar with the mass.gov website. We have a new web platform, or I say it got a glow up because it's got some newly developed sort of areas on there that really help to map out some of our resources that we have, including this week, including our behavioral health team, and additional resources for special education and guides for family well-being. And so we hope to continue to add to that. And then childwellbeingandtrauma.org has some wonderful resources. I love the toolkit and the videos that they have that are available. And so please feel free to check that out. I think you'll find it very helpful. This is all of our contact information. If you would love to reach out to us to get additional information. I know that I'm looking at the time and I see that we're running short as far as answering questions, but I promise you we will look at that and get back to anybody who had a very specific question. We will make sure that we email you with those answers. And just to thank you. We know that you have very busy days and we appreciate you joining us for this hour. And please feel free to reach out to us. We'd love to connect. So thank you all so much. Wow, look at that. It's 1 o'clock.
Thank you. I also did want to mention, I put it in the chat, but we'll share a lot of these resources that Amy and the team chatted about in an email. So if you registered today, you will get that information, and we'll make sure the recording is available as well. So thank you all for coming.
Thank you. Have a great afternoon.
Thank you.
Thank you.
Thank you.
Thank you.